February 5th, time for more Black Excellence. Lego. Today's subject is Mr. Daniel Hale Williams. If you don't know, you're about to know. Mr. Daniel Hale Williams is known as a medical legend and heart surgery pioneer. He was born on January 18th, 1856 in Hollidaysburg, Pennsylvania. He was actually the fifth child of 7 to his parents, and at the age of 10, his family moved to Baltimore shortly after his father died of tuberculosis. While there living with other relatives, he was a shoemaker's apprentice, but didn't really like that job, which is when he decided to pursue his education in the medical field. It was here he would work as an apprentice for another esteemed surgeon, Dr. Henry Palmer. Moving forward, he would graduate with an MD degree from the Chicago Medical College, which today is now known as Northwestern University. Skilled in his craft, Dr. Williams would actually open his own private practice after graduating, where he would treat white and black patients. The reason for this is because at the time, plenty of American private hospitals would not admit African American patients or even hire African Americans on their medical staff. So, in opposition to this, he founded the Providence Hospital in 1891, which provided training residency for African American doctors and a training school for African American nurses. Also, it was the first hospital to have an interracial staff. In 1893 is where he made his biggest splash in the medical world, becoming the first surgeon ever to successfully perform open heart surgery on a human. He did the operation without antibiotics, x-rays, surgical prep work, or the modern tools for surgery at that time, and his patient, James Cornish, was discharged from the hospital just 51 days later. Because of this, he was actually appointed as the chief of surgeon to Freedman's Hospital in Washington, D.C. in 1894, where he served in that position up until 1898. The following year in 1895, he co-founded the National Medical Association for Black Practitioners because the American Medical Association did not extend membership to black doctors and black nurses. He would go on to fulfill his life's work in the medical field, and in 1913 became a charter member and the only African-American doctor in the American College of Surgeons. Afterwards, at the end of his days, Dr. Williams would pass due to a stroke on August 4th, 1931 in Idlewild, Michigan. And although he's passed, Dr. Williams' presence can be felt in the medical field to this day, and we thank him for all that he's done within the medical field. Tune in tomorrow, guys, for more Black Excellence during Black History Month. Peace.